Welcome back. For some, it's taken longer to get an ambulance in one North Metro city lately.
Now city leaders want to see if they can have a voice in trying to correct that.
Decades ago, state leaders divided Minnesota into ambulance primary service areas, or PSAs. Most cities don't have input over which ambulance companies cover them.
We are a partner. We need to have some level of control of how ambulance services is providing within our community.
North Memorial Health currently covers Lino Lake's PSA, but that is about to change. Lino Lake's PSA is technically under Fairview, which did not have its own ambulances. It's subcontracted with North Memorial for those ambulances. Last year, University of Minnesota and Fairview merged to create M Health Fairview. That company does have its own ambulances, and it notified Lino Lakes that starting June 1st, that's what would cover the PSA.
In terms of public safety for the community and looking at that, that is incredibly troubling. That we are 6 months from this change, and we don't know what that service looks like.
Chief Swenson does know that coverage and response times lately in Lino Lakes have suffered, with some lengthy response times of a half hour or more in some cases.
You know, the old attitude was, if it's not broken, why fix it? And my response was simply, well, it might not be broken for you, but it's not working for us.
In December, City Council passed a resolution to say the city wanted the state to re-examine how it makes decisions based on ambulance coverage and designate the change within Fairview a certain way.
They're trying to determine is this just simply a name change, or was this a change of ownership?
And if they determine it was change of ownership, that's where there could be some discussion opening.
That would provide public input.
The City Council resolution also pushes public safety to look at other avenues for ambulance service if needed.
This isn't about Lino Lakes starting an ambulance service. This would likely be a discussion about, are there other vendors that could provide service under a contract similar to what we have today for ambulance service.
For his part, Chief Swenson said he will continue to attend state meetings to get answers.
City leaders also worked with state lawmakers in last year's session in St. Paul to change laws about how PSAs are set up and how they can change, but those bills went nowhere.